we journey back in time, not to a world of shining knights and fairy tale castles, but to a reality far stranger and frankly more stomach-turning. We are pulling back the curtain on the weird and wonderful world of Renaissance medicine. You step into a dimly lit room. The air is a battleground of smells, dried herbs, melting beeswax, and a faint, sharp, metallic tang that sets your teeth on edge. The walls are a chaotic collage of astrological charts, and on a heavy oak desk, a human skull stares blankly next to a bubbling glass beaker. A man in dark, heavy robes isn't checking your pulse. He's staring into a vial of your urine, as if it's a crystal ball holding all the secrets of the universe. This was the office of a Renaissance physician, a place where science, magic, and pure, unadulterated guesswork collided in a spectacular and often fatal fashion. The story of this medicine will unravel mysteries you never even thought to question, like why our ancestors believed powdered mummies and pigeon droppings were cutting-edge wonder drugs. Before we descend into this fascinating madness, if you find this journey into bizarre corners of history as captivating as I do, consider becoming a fellow explorer. A simple click on the subscribe button ensures you never miss a trip. If a particular fact makes your jaw drop, let me know in the comments. I love hearing when and where you're watching from, as our community of curious minds spans the entire globe. Your likes and shares are the fuel that powers these journeys into the past. Now, dim the lights. Let the hum of fan create a gentle whisper sound. Your journey starts with a misery we all know. You wake up one morning feeling dreadful. Your head is pounding. Your skin is a clammy battlefield of hot and cold, and a fever is tightening its grip. You seek out a physician, a man praised for his education at a grand university. You expect him to ask about your symptoms, perhaps to press a cool hand to your forehead. Instead, after a cursory glance, he bombards you with a series of bewildering questions. What is your usual mood? Are you generally a cheerful person, or are you quick to anger? Most importantly, what did you eat for dinner last night? To understand why your personality is more important to him than your pain, you have to grasp the magnificent, ancient, and almost entirely incorrect theory that was a bedrock of his every medical thought. This is the theory of the four humors. The physician explains, with the patience of man revealing a divine truth, that this theory, passed down from the titans of ancient Greece, Hippocrates and Galen, is the key to all medicine. The universe, he tells you, is made of four elements: earth, air, fire, and water. Being a tiny mirror of the universe, is therefore also composed of four corresponding fluids, or humors. He breaks them down for you. First, there is blood, which corresponds to the element of air. Its qualities are hot and moist. It's linked to springtime and a sanguine or cheerful and optimistic. Second, there is phlegm, which corresponds to water. Its qualities are cold and moist. It's associated with winter and a phlegmatic or calm and unemotional. There is yellow bile, corresponding to fire. Its qualities are hot and dry. It is linked to summer and a choleric, or irritable and angry. And finally, there is black bile or melancholy, corresponding to earth. Its qualities are cold and dry. It is associated with autumn and a melancholic, or sad and depressive. This complex web of connections wasn't a fringe belief. It was the absolute, unshakable core of all medical diagnosis. It was a system where being a perpetually cheerful person was a pre-existing medical condition. The doctor continues, his voice resonating with authority, depends on these four humors being in perfect, harmonious balance. Every single illness, from a head cold to the bubonic plague, is simply the result of an imbalance, too much or too little of one of these vital fluids. He looks at you, his eyes narrowing. Your fever is a sign of excess heat. The fact that you're sweating means there is also excess moisture. Hot and moist are the qualities of blood. Therefore, his diagnosis is simple: you have an excess of blood in your system. Your sanguine humor is dangerously out of balance. You can see how this system, as flawed as it was, and rational framework for the Renaissance doctor. It's a point of debate among historians. Was humoral theory a complete barrier to medical progress, or did it, in its own peculiar way, provide a logical and systematic method for making sense of the chaos of human illness? Sitting there feverish and confused, it feels both logical and absolutely terrifying. Humoral theory was the original everything is connected worldview. Your cheerful personality, the spring weather, and the roast chicken you had for dinner were all part of a grand, fluid-based conspiracy, and if the diagnosis flows from the theory, so too does the treatment. Since you have too much of a hot and moist humor, blood, the cure is obvious. You must be made colder and drier. The doctor might first prescribe a change in diet, telling you to avoid hot foods like red meat and wine, and instead consume cold foods like fish, fruits, and cucumbers. But diet is a slow method. The most direct and efficient way to treat an excess of humor is to simply remove it from the body. The doctor dips his quill in ink and writes you a prescription. The cure for your fever is to get rid of the surplus blood. The answer to almost every medical problem you're beginning to suspect is to somehow drain a part of yourself away. You leave the physician's study, his diagnosis of too much blood echoing in your mind. You now understand the fundamentally flawed theory that governed every single medical decision of the age. But a theory is not a cure. You still need the treatment. Where you go to have this dangerous fluid removed, or to acquire the strange concoctions of cold herbs the doctor also prescribed. Your next stop is not a bright, clean pharmacy. You're heading for the dark, cluttered, and magical workshop where all the weird and disgusting medicine of the Renaissance was born, the apothecary shop. You clutch the prescription in your hand, a list of herbs to counteract your body's heat, and, most importantly, the instruction for a phlebotomy. Your first stop is the apothecary. You can spot it from the street by the painted sign of a mortar and pestle. Even before you enter, a complex and powerful aroma meets you, an invisible wall of smells, both enticing and strange. You push open a heavy wooden door, and the scent becomes an overwhelming, multi-layered experience. You can pick out the sweet, comforting notes of cinnamon and cloves, the sharp, clean scent of lavender and rosemary, and the deep, earthy smell of dried roots like licorice and mandrake. There are other, less familiar odors, the faint mineral tang of ground-up gemstones, the musky scent of animal glands, and a dusty, ancient smell that seems to rise from the very floorboards. Your eyes adjust to the dim light. It is a cavern of mysterious treasures. The walls are lined floor to ceiling with wooden shelves, crammed with hundreds of ceramic jars. Many are beautifully decorated tin-glazed earthenware pots called albarelli, their surfaces painted with intricate blue and yellow designs, and their contents labeled in elegant Latin script. From the rafters above hang huge bunches of dried herbs, desiccated seed pods, and, alarmingly, a variety of dried animal parts, the skin of a snake, and what looks disturbingly like a preserved body of a small alligator or crocodile. Suspended in a place of honor is a long, spiraling, ivory-white tusk. The apothecary presents this as a horn of a unicorn, an object believed to be a universal antidote to all poisons. It is the tusk of a narwhal, brought at great expense from the icy seas of the north. The crocodile and the unicorn horn are not just decorations. They are a form of marketing, meant to inspire awe and serve as proof that the apothecary is a worldly man with access to rare, powerful, and exotic substances. From a back room filled with the clinking of glass, the apothecary himself emerges. He is not a university-trained physician, but a master craftsman in a leather apron, a member of a powerful guild like the grocers or spice merchants. The physician diagnoses your humoral imbalance, but the apothecary is a skilled artisan who knows how to compound the physical remedy. Historians debate the true role. Was he simply a tradesman following a doctor's orders? For the vast majority of the population who couldn't afford a physician, the primary healthcare provider, the evidence suggests that for many, the apothecary was their first, last, and only stop. They would describe their cough or fever, and the apothecary would mix up a remedy on the spot, combining his extensive knowledge of herbalism with the principles of humoral theory. You watch as he prepares a prescription for another customer, consulting a large, leather-bound book. He is mixing a batch of Theriac, the most famous and complex cure-all of the Renaissance world. It was a thick, honey-based concoction that could contain more than 60 different ingredients, including opium, viper's flesh, cinnamon, and a host of other rare spices. It was fabulously expensive and believed to be effective against everything from poison to the plague. It was the ultimate multivitamin. If your vitamins included narcotics and snake meat, you look closer at the Latin labels on the hundreds of jars. You see familiar names like Rosa for rose petals or Menta for mint, but then your eyes fall upon other jars, and a chill runs down your spine. One is labeled Cranium Humanum, powder human skull. Another, Mumia, contains the ground-up remains of ancient Egyptian mummies. A third contains Oculi Cancri, or crab's eyes, which were actually the smooth, white-stomach stones of crayfish. You realize this is not merely a pharmacy. It is a cabinet of curiosities, a hardware store of magical ingredients, and a charnel house of grisly remedies. It was a health food store where half the ingredients were toxic, and the other half were already dead. The apothecary turns to you. He prepares a simple mixture of cooling herbs for your fever, but he shakes his head at the last item He says his voice is dry as the herbs he grinds. You must go elsewhere. His trade is in compounding substances, not in the letting of blood. You need a different kind of specialist entirely. A man who might offer you a shave and a haircut before he performs the most common surgical procedure of the age. You leave the apothecary, your small bag of herbs in hand. The final part of your prescription still needs to be filled, and it is by far the most daunting. The physician diagnosed you with an excess of blood, and now that excess must be removed. You're heading for phlebotomy, or, as it's more commonly known, a fear knots in your stomach, but you push it down. This is not some fringe, experimental treatment. This is the single most common and trusted medical procedure of the age, the logical and necessary conclusion to your doctor's diagnosis. You arrive at the establishment of the man who will perform the deed. Before he begins, he consults a leather-bound almanac and a complex chart depicting a human figure covered in the symbols of the zodiac. This is a zodiac man, a crucial piece of medical technology. Each sign of the zodiac was believed to govern a specific part of the body. Aries the head, Taurus the neck, Gemini the arms, and so on. The practitioner checks the current position of the moon. He nods, satisfied. The moon is not in Gemini, so it is a safe day to bleed you from the arm. To open a vein when the moon was in its corresponding sign was considered incredibly dangerous. It was a level of scientific caution that was both impressive and, given the nature of the procedure, spectacularly misdirected. With the stars aligned, the process can begin. Bloodletting was a go-to cure for nearly everything: fevers, headaches, infections, apoplexy. The practitioner sits you down and ties a strip of leather tightly around your bicep, making the veins in your forearm stand out. He might choose a lancet, a small, pointed steel blade, or a fleam, a tool with several small folding blades. He selects a vein and, with a swift practice motion, makes a small, you flinch at the sting, dark and rich, begins to flow into a special pewter or brass bowl, often marked with lines to measure the amount being removed. You watch, mesmerized and horrified, as your own vital fluid fills the bowl. He will continue until he has removed what he deems the correct amount to restore your humoral balance, perhaps half a pint or even a full pint. Alternatively, he might use cupping. A small glass cup would be heated with a flame and then placed on your skin. As the air inside cooled, it would create a vacuum, pulling the skin up into a tight. He would then make small cuts in the raised flesh, allowing the bad blood to be drawn out. Or he could turn to nature's own little phlebotomist. He would take several of the slimy, wriggling creatures from a jar and apply them to your skin. You would sit there as they slowly and steadily drain the blood from you, swelling into dark, bloated sacs before they drop off. The result is the same. A significant amount of your blood is now outside your body. You begin to feel weak and lightheaded. Far from being a sign of danger, was often interpreted as a positive outcome. The faintness was seen as proof that the excess heat of the sanguine humor was leaving your body. The procedure was considered a success if the patient nearly passed out. By that logic, nearly every procedure was a stunning success. Medical historians still debate this. Was bloodletting uniformly harmful? Some speculate that for a patient with dangerously high blood pressure, it might have temporarily provided some relief. But the overwhelming consensus is that for an already sick and weakened patient, losing a significant amount of blood, the very fluid that carries oxygen and fights infection, was almost certainly detrimental and in many cases fatal. Centuries later, George Washington would be bled a massive quantity of blood for a throat infection, a treatment that almost certainly contributed to his death. The bleeding is finally finished. The practitioner bandages your arm tightly, pale and unsteady, but you're assured that you've been given the best possible care. As you recover your senses, you look at the man who so expertly opened your vein. He is wiping his lancet clean, ready for his next customer. And then you notice the other side of his shop: chairs, mirrors, razors, and scissors. You realize with dawning horror that the medical specialist you have just entrusted with your life is the very same man you would come to for a shave and a haircut. You have just met the multi-talented and often profoundly dangerous figure, your head light from the bloodletting, trying to process this strange reality. How did grooming and surgery become so inextricably linked? The answer lies in the rigid class structure of the Renaissance. Surgery was not a high-status specialty. The physician was a gentleman and a scholar. He worked with his intellect, diagnosing the subtle imbalances of the four humors. He would never stoop to the messy, manual labor of actually cutting into a human body. That was bloody, hands-on work fit only for a craftsman. and who in a Renaissance town already had a shop, a steady hand, and an array of very sharp steel tools. It was a strangely logical, if unsettling, partnership. If a man could be trusted to take a razor to another man's throat for a shave, it was a short leap to taking a lancet to his arm for bloodletting, or a pair of pliers to his mouth to pull a rotten tooth. You look outside his shop and see the iconic symbol of his trade. You had always seen it as a piece of festive decoration, but now you understand it's true. The pole itself represents a staff that a patient would grip to make their veins bulge. The white of the spiraling stripe represents the clean linen bandages used to wrap the wound. That represents the blood that soaked those bandages after the procedure. The pole was not a cheerful sign. As a graphic menu of the services offered within, the barber surgeon's practice was surprisingly broad. Bloodletting was his bread and butter. He was also the town's only dentist. He would lance boils and abscesses, set broken bones with crude splints, and stitch up minor wounds. And at the most extreme end of his practice, he performed amputations. This was a brutal, lightning-fast procedure performed without anesthetic, a desperate last-ditch measure usually reserved for battlefield or for a case of gangrene. The chances of survival were slim. Were these men dangerous, uneducated butchers, or were they highly skilled practical surgeons? The truth is they were both. A poorly trained barber surgeon with unwashed hands was an agent of infection and death, but a master barber surgeon who had gone through a long apprenticeship could be a figure of immense practical skill. His hands-on daily experience with the reality of the human body often gave him a far better understanding of practical anatomy than the university physician, who learned everything from ancient and often incorrect books. You pay the barber surgeon his fee. You have now been treated by the three main pillars of the Renaissance medical world: the physician who diagnosed, the apothecary who compounded, and the barber surgeon who performed the manual procedure. As you steady yourself, your mind returns to the first man you saw. You think of his strange diagnostic methods, his focus on the stars and humors, and you remember him holding that glass vial of urine up to candlelight, peering at it with the intensity of a jeweler. What on earth could he have learned from that? Your journey is about to take you back to the physician's study to explore one of the most visually distinctive and deeply bizarre diagnostic arts of the age, the science of the urine wheel. You return to the physician's study. On his desk is a special flask made of clear glass called metulla, designed specifically for uroscopy. He takes the sample you provided and holds it up to the light of a candle. He is not merely glancing at it. He's performing a medical examination as complex and codified as any modern lab test. Uroscopy was not quackery. It was a highly developed and respected diagnostic art. The physician was looking for 4 key properties: the urine's color, its consistency, its sediments, and even its smell and taste. To interpret what he sees, he turns to an intricate chart hanging on the wall. This beautiful, hand-painted diagram shows at least 20 different shades of urine arranged in a circle. Each color has a specific name and corresponds to a particular state of the body's humors. Whitish color might indicate an excess of cold, wet phlegm. A fiery reddish hue suggests an overabundance of hot, dry yellow bile. Almost black color was considered the most dangerous of all, a sign of burnt, melancholic black bile, and a likely harbinger of death. It was like a paint color swatch from a hardware store that specialized exclusively in shades of sickness and decay. But his analysis doesn't stop at the color. He gently swirls a metulla, observing its consistency. Is it thin and watery or thick and syrupy? Watching for any particles to settle. The metulla itself was seen as a perfect microcosm of the human body. Sediment in the bottom related to ailments of the lower body. Cloudiness in the middle corresponded to the torso, and floating particles at the top related to the head. It was a full-body CT scan performed with a single glass flask and a whole lot of imagination. Now comes the part that required a truly dedicated physician. He unstoppers his metulla and takes a delicate, checking for any foul odor. And then, for the final definitive test, he might dip the very tip of his finger into the liquid and touch it to his tongue. A distinctly sweet taste was a known sign of what we now call diabetes. Its old name, diabetes mellitus, literally means a honeyed or sweet siphon, a name derived directly from this ancient and stomach-turning diagnostic technique. Was uroscopy pure charlatanism? Despite its flawed humoral foundation, did it represent a primitive form of non-invasive diagnostics? A skilled physician could have spotted genuine clinical signs: the dark urine of jaundice, the cloudiness of a urinary tract infection, the blood that indicates kidney problems. His interpretation of these signs would have been wrong, but his observation was not entirely useless. He was seeing real symptoms, just filtering them through a completely imaginary theoretical lens. The physician now completes his examination. He nods gravely. The reddish tinge he has observed, he informs you, confirms his initial diagnosis. Your sanguine humor is indeed in a state of excess. The urine, which he believed was a distillate of the blood, has provided the scientific proof. You're struck by the elegant, self-confirming loop of theory and diagnosis. But as your mind wanders, you think back to the apothecary shop. You remember the strange, unsettling labels on the ceramic jars, ingredients far more bizarre than anything in the doctor's medulla. You recall the jar labeled cranium humanum and the prize mumia. Your journey into the weird medicine of the Renaissance is about to take a much darker turn into the most gruesome and shocking corner of the pharmacist's dispensary. You're about to enter the grisly world of corpse medicine. Your mind recoils from the strange science of the urine wheel and is drawn back to the apothecary shop, to the memory of those enigmatic jars. This is your entry into the deeply weird world of corpse medicine. It is a mainstream historical fact that for centuries, remedies made from human body parts were a common, accepted, and often very expensive part of the official pharmacopoeia. At the top of this strange market was mumia, a dark, crumbly, resinous powder made from the ground up remains of ancient Egyptian mummies. It was imported at great cost and was prescribed as a panacea, a cure-all for everything from headaches to plague. The logic was that the bitumen and other resins used in embalming held powerful, almost magical preservative qualities. By ingesting these substances, some of that preservative power could be transferred to your own ailing body. The demand for authentic Egyptian mummy was so great that it led to a truly gruesome international trade in counterfeit corpses. When the supply of genuine pharaohs ran low, enterprising merchants created fake mummies. They would take the fresh corpses of executed criminals or plague victims, stuff them with bitumen, dry them in the sun, and wrap them in rags. These fakes were then powdered and sold to European apothecaries. A wealthy nobleman in London suffering from a cough might pay a fortune for what he believed to be a 4,000-year-old Egyptian king, when in fact he was swallowing a bit of a recently deceased camel driver from Cairo. But mummies were just a star attraction. Powdered human skull was a specific remedy for neurological conditions like headaches, dizziness, and epilepsy. The thinking was that since the skull houses the soul, a powder made from it could treat ailments of the head. The most potent skulls were believed to come from young men who had died a sudden, violent death, as it was thought their life force was still trapped within the bone. Other body parts had their uses too. Rendered from a healthy corpse by the local executioner, was sold as an ointment for gout and rheumatism. And most disturbingly, fresh was considered a powerful tonic, a first-rate cure for epilepsy. It was not uncommon for sufferers to stand at the foot of the public scaffold during an execution, cup in hand, to pay the executioner for a draught of the still warm blood of the condemned man. You are what you eat philosophy, which is a terrifying thought when you are, in fact, consuming another human being. Historians and anthropologists still debate the underlying logic of this medical cannibalism. Some see it as sympathetic magic, a belief that the life force of one person could be transferred to another through consumption. Others argue it was a form of desperate, last-ditch empiricism. In an age with no effective cures for terrible diseases like epilepsy, it was a why not try it approach driven by absolute desperation. This entire grisly trade was often facilitated by the public executioner. He had privileged, first-hand access to the freshest possible ingredients. After a hanging or beheading, he would preside over the dismemberment of the corpse, selling the blood, the fat, and the skull to the apothecaries who needed them. It was a lucrative and horrifying side business. You recoil at the thought of this pharmacy of the dead, but you must understand that this was not seen as black magic. Not all of Renaissance medicine was so overtly gruesome. Much of it was based on a gentler, more poetic, and equally mistaken philosophy. It was a belief that God, in his infinite wisdom, had not abandoned mankind to sickness, but scattered clues to cures all across the natural world, hidden in plain sight. You now turn from the dark world of the human body to the green and sunlit world of plants, to explore the beautiful and elegant theory known as a doctrine of signatures. You step out of the apothecary shop, wandering into a nearby garden to clear your head. Surrounded by flowering plants, you're about to discover a completely different branch of Renaissance medicine. It was a philosophy that saw healing not in the bodies of the dead, but in the living world of plants, a world they believed was a divine map of cures. This is the doctrine of signatures. Its premise was simple: knowing humanity would suffer from disease, or a sign on the planet of the Earth to indicate their intended purpose. The entire natural world was a living textbook. You kneel down and look at the world through the eyes of a Renaissance herbalist. The clues are everywhere. The convoluted kernel inside looks exactly like a miniature human brain. The signature is unmistakable. Walnuts must be the cure for ailments of the head. You see a small, delicate flower called eyebright. Its petals are marked with yellow spot and tiny, thread-like purple veins, looking with startling accuracy like a tiny. For centuries, it was the primary remedy for all manner of eye complaints. You see another plant, lungwort, with large, broad leaves covered in small, giving them an appearance that reminded observers of diseased lung tissue. Its signature declared it to be the cure for coughs and other respiratory troubles. The system was intuitive. If you had a problem with an organ, you just had to find a plant that looked vaguely like it. This way of thinking was championed by figures like the Swiss physician and alchemist Paracelsus, who saw it as a profound connection between the microcosm of the human body and the macrocosm of God's creation. It was a poetic and elegant system, turning every walk in the woods into a potential journey of medical discovery. Historians debate this. Was the doctrine a purely mystical concept, or did it function as a kind of primitive mnemonic system in an age before formal botanical classification? Linking a plant's appearance to its supposed use was a powerful and easy way to remember and transmit herbal knowledge. The system was deeply flawed. Many plants that resemble an organ have no effect on it. And conversely, some of the most powerful medicinal plants, like the bark of the willow tree, the natural source of the active ingredient in aspirin, have no obvious signature at all. You leave the quiet garden, the elegant logic of the doctrine of signatures echoing in your mind. It is a world away from the grim remedies of corpse medicine. Both systems, however, were desperate attempts to find pattern and purpose in a world filled with random, terrifying sickness. But these cures, whether from a skull or a walnut, were primarily for internal ailments. What happened when the problem was more immediate and physical? A cancerous tumor, a bladder stone too agonizing to pass. You could not rely on a powder or a potion. You needed a craftsman with a steady hand and a sharp knife. Your journey now takes you back to the shop of the red and white pole to witness the brutal, agonizing, and often fatal world of Renaissance surgery. You return to the barber surgeon's shop. You've seen his skill with a lancet. Now you will witness his true and most terrifying purpose. You're here to see a surgery. A heavy wooden table, scrubbed but still stained with dark memories, has been placed in the center of the room. The barber surgeon is laying out his tools. An array of knives, a small curved saw, metal probes, hooks, and forceps. The patient is a man in middle age, his face pale with long suffering. He is afflicted with a bladder stone, a common and excruciatingly painful condition. He has tried every herbal remedy and has finally come to this desperate choice: endure the agony of the surgeon's knife or face a certain, slow, and agonizing death. He's helped onto the table. There is no operating theater, no sterile field. There is only this room with its dust and its flies. Now you must understand the two great and terrible absences that define this entire experience. The first is anesthesia. There is nothing to dull the pain. The man will feel everything. He has been given a large draught of strong wine and a leather strap to bite down on, but he will be awake and fully conscious. The second absence is any concept of germs or antiseptic practice. The surgeon's hands are unwashed. His instruments were perhaps wiped on a rag after their last use, but they are crawling with invisible bacteria. Even if the surgeon's knife did not kill you, the infection that followed almost certainly would. The procedure is a lithotomy, the removal of the bladder stone. The patient is forced onto his back and held down by two large, strong assistants. Their only job is to restrain the man when the agony becomes unbearable. The surgeon makes his incision. A muffled scream escapes the patient. The surgeon works with a grim and focused speed. Speed is his only form of mercy. He must get in, find the stone, and get out before the patient dies from shock and blood loss. He uses a metal probe to feel for the stone, then works a curved, scoop-like instrument in beside it. There is a terrible grating sound. The patient thrashes, and the assistants bear down with all their weight. Finally, with a last agonizing pull, the surgeon extracts the stone, a jagged, ugly mineral deposit, and holds it up in triumph. But the ordeal is not over. The wound is bleeding freely. The primary method to stop it is cauterization. The surgeon's assistant takes a specially shaped iron from a glowing charcoal brazier. It is red hot. The surgeon takes it and, after a moment of terrible anticipation, presses the searing metal into the open wound. The patient screams, a sound that is barely human, and the room fills with the acrid, sickening smell of burning flesh. But the bleeding stops. The operation, by the standards of the day, has been a success. The patient has survived the table. Historians debate whether the renewed interest in anatomy during the Renaissance actually led to better surgical outcomes, or did a profound ignorance of pain management and infection mean that survival rates were no better, and possibly even worse, than the darker ages that preceded it? Looking at the pale, trembling, and now horribly burned man on the table, you suspect the latter. The motto of the Renaissance surgeon might as well have been, "The operation was a success, but the patient died anyway." This kind of brutal surgery was a relatively rare event. But there was another medical ordeal, one just as dangerous and agonizing, that took place far more frequently. It happened not in the public space of the barber surgeon's shop, but in the private domestic space of the home. It was a trial of endurance and pain faced not by men, but exclusively by women. Your attention now turns away from the surgeon's table and toward the birthing bed, to explore the perilous, female-dominated world of Renaissance childbirth. Our journey through the strange and often terrifying landscape of Renaissance medicine has only just begun. We've seen diagnoses based on personality, cures made from the dead, and surgeries that were a race against death itself. But there is so much more to uncover. We have yet to meet the figure in the beaked mask who walked through plague-ridden streets, to understand how madness was treated in an age of humors and demons, and to witness the dawn of a rebellion that would change medicine forever. If this dive into the past has sparked your curiosity, make sure you're subscribed and have notifications turned on for part 2. We will venture into the world of childbirth, plague, alchemy, and the very first sparks of modern medical science. Thank you for joining me on this journey. Until next time, stay curious.